let's talk about the SI joint today. So just a basic review of anatomy: spine, ilium, your sacrum. The SI joint's right here. It articulates between the ilium bone and the sacrum. Okay. What I'd like to do is talk about two seminal articles that we in physical therapy actually use to discern an SI joint dysfunction. The first one being from Lazet, and the other one being from Van der Werf. And actually, in my blog post, there's actually more detail about where to find the articles, and I'd like to have you actually reference them if you want more information about these tests. I'm going to actually go into a whole demonstration of the test in a second. But what the two articles talk about is they basically state that there's not one key or one perfect SI provocation test. Okay? They actually state that there's really a combination of tests that should be performed to increase our accuracy at diagnosing an SI joint dysfunction. If you actually do the test in combination, you actually increase both your sensitivity and your specificity for diagnosing an SI joint dysfunction. So both articles do indeed state that the accuracy of the tests will improve if 3 of the 5 tests are positive. Okay, so Van der Werf actually takes it a step further and states that if 3 of the 5 tests are positive, the sensitivity increases to 85% and the specificity increases to 79%. Okay, so these are tests that we certainly use to discern whether that SI joint is involved. If we do all 5 tests and the 5 tests are negative, you can it's pretty likely that the SI joint is not involved. Okay, so with that said, let's run through the key 5 tests. The first one being the thigh thrust or the femoral shear test. Second one being the as-is, the ASIS compression test, or actually distraction test. The sacral compression test, the Gainsland's test, and the Faber's test. Okay. So first one, let's do the thigh thrust or the femoral shear test. Let me come a little bit closer this way. Okay. So if we're trying to provoke symptoms on, say, her left side, okay, what we're going to do is have her opposite leg down straight, bend up to 90 degrees, the affected side. I'm going to take my hand and place it on the base of the sacrum. So have her roll towards me and place it right at the base of the sacrum. Okay, stabilize the sacrum. I'm actually going to push and thrust down through her femur in order to shear the SI joint. So when I'm pushing down through, I'm going to push with probably a good 6 thrusts in order to provoke symptoms. Based upon the 2 articles, this is actually the most sensitive of the 5 tests that will demonstrate. So if there's one that you choose, if you're short on time, it would be the femoral shear, or the thigh thrust test. All right, that's test number 1. Test number 2 is the as-is, the ASIS distraction test. So in a sense, you're coming in, you're trying to distract the SI joint, or the as-is, or in a sense, you're actually compressing the SI joints from behind. So you can think of it in either terms. So I'm coming in on the inside part of the as-is on this side, ASIS, and the inside part on this side. And essentially what I'm going to do is she just relaxes, and I'm going to push and I'm going to compress, depends on how you think about it. I'm distracting the ASISs, thereby compressing the SI joints, and I'm going to hold for 30 seconds. Okay, same thing, looking for, is that your comparable sign? Is that pain in your SI joint or in that area that you have your pain? Okay, if it is, then it's a positive test. Okay, let's have you roll onto your left side. Okay, so the sacral compression test, same thing, you're going to contact on the outer portion of the ilium above the greater troch. So don't push on the greater trochanter. You're going to push right through here. And I'm going to use my body weight to come in and provide a compression force down through the SI joint. Okay, same sort of idea. I'm going to push down, I'm going to compress, and maybe do 6 thrusts. Or you could compress and hold for 30 seconds. But for her, we'll get in there and push down, ask the patient if that provokes their pain, their comparable sign. And if it's positive, that'd be obviously or cause pain. It's a positive test. Let's have you roll onto your back for me, and let's maybe do it from this side over here. This is actually Gainsland's test. Right on over this way. Okay, so it's kind of a modification of the Thomas test, which is a test we do for hip flexor and quad flexibility. But we're going to drop one leg over the side. Okay, we're going to put a little bit of a downward force into this, thereby pushing here, causing an anterior tilting effect of the pelvis. We're going to bring her up to about 90 or so degrees here, causing more of a posterior rotation or a posterior tilting effect of the ilium. And we're essentially going to push down here and push up at the same time. Same idea as far as the shearing effect to the sacrum. So I'm pushing down here, I'm pushing up there. Don't have to go too vigorously, but same idea, about 6 thrusts. And does that reproduce pain? If it does, it's a positive test. Okay? And then the last one, which is not the most specific. That one, the last two being probably the least specific of the 5 tests, is Faber's test. So do the figure 4 sign, cross over here, stabilize the opposite ilium on the as is. Okay, and same idea. We're just same thing, not too vigorously. We're going to push down through and see if we can provoke her symptoms once again. Of course, this is a test that we use to discern any sort of hip involvement, any sort of internal derangements in the hip. So it's not the most specific test, but in combination with the other 5 tests, it can be very sensitive and very specific, as we stated earlier. So just to review, so if at least 3 of these 5 tests are positive, we think the SI joint. Okay, if none are positive, then it's more than likely not an involved structure. And I think that's good. Thank you much.